Dr. Ruwan Ranawaka. He's a consultant in critical care medicine who works in National Hospital of Sri Lanka, Colombo. He will talk to us on having the appropriate tools and knowing how to use them. Let's listen to Nuwan to see what he's talking about. What are these interesting appropriate tools? Over to you, Nuwan.
The PEEP level to the patient to support the patient's breathing. As you all know, that the giving PEEP would improve the oxygenation, especially in patients with pulmonary edema, because it will disperse the water away from the lungs. This is the extension of that high flow nasal cannula, as you all may have experienced, that is non-invasive ventilation. It gives you more pressure support. So the PEEP of 10, 12, sometimes 15 can be delivered. And most importantly, it can be used to support patients when they are exhausting with their breathing. So when the respiratory muscles are getting exhausted, in patients with pulmonary edema, you will be able to provide the pressure support to assist the patient's breathing. When it comes to patients who are deteriorated more than that, you all can use this invasive ventilation. I'm not going to in detail of invasive ventilation because Dr. Nimangi may have discussed this with you in detail. But there's one important fact I would like to highlight here. Do you think that this machine or the ventilator would provide support only to the lungs? Basically not. Definitely provides the respiratory support. It will improve oxygenation. It takes out carbon dioxide from the patient's body and supports ventilation, supports the respiratory muscles. But when it comes to cardiac patients, heart is also supported with this machine. Giving the pressurized oxygen or the PEEP level to the thoracic cavity improves the function of the heart itself. You can imagine that heart as a pump which is inside another pump, that is the thoracic cavity. So if you give a pressurized oxygen or pressurized air into the thoracic cavity, which is the pump surrounding the heart, it will support the pumping action of the heart itself. So it will reduce the burden to the heart, especially when the heart is failing. Especially the venous return will be controlled, and the resistance against which heart has to pump can also be controlled. All those things would improve the function of the heart. So therefore, in a patient who is having heart failure and pulmonary edema, giving invasive ventilation would improve the oxygenation, reduce the pulmonary edema, and as well as that, it will improve the function of the heart. Okay, now we will change the theme. What about the hemodynamics? When it comes to patients who are having cardiogenic shock, this is a very good tool to save the patient. As you all may know, this is intra-aortic balloon pump. So there's a balloon inside the aorta which inflates and deflates. Because of that, it supports the heart. There are two aspects of cardiac function which is supported by intra-aortic balloon pump. One major benefit is it improves the coronary circulation. So if a patient with MI is having cardiogenic shock, the coronary circulation will be improved by the pumping action of this machine. When the balloon inflates, it will direct blood to the coronary arteries. And on the other hand, when the balloon deflates, it draws blood out of the heart, so therefore the cardiac function will be supported. And then it will be distributed all over the body. So this is very important when it comes to cardiogenic shock. And one more important thing I would like to tell is that it is an instrument you have to adjust according to the patient's requirement and how it functions. Just putting the intra-aortic balloon pump may not be giving the adequate benefit, and not only that, it may be harmful if things are not working properly. Imagine if the balloon is inflating when the heart is pumping, so it will block the flow. So therefore, it should function accurately. And in your aspect, what you have to do is you have to monitor these waveforms, these figures, these numbers to check whether it's functioning adequately and properly. If it is not functioning properly, there are things you have to adjust. And one important fact I should highlight at this point is that when you put the intra-aortic balloon pump, your pressure readings in the monitor of the patient is inaccurate. You have to check the pressure readings of the console of the IABP to get an adequate or accurate level. Even if it is a invasive blood pressure monitoring which is noted in the multi-para monitor over the patient, it is inaccurate. So that's the one fact you have to keep it in your mind. Now, I'm going to introduce another separate instrument which we are using sometimes and which is very handy when it comes to cardiac patients. So that is cardiac output monitoring. So there are several methods like PICO, LICO, and FlowTrack. And one interesting machine is this FlowTrack. Now you all can see all the hemodynamics are measured in this machine. The application of this machine is very simple. Putting an arterial line and measuring the arterial blood pressure and fixing to this machine. Nothing complicated. And most importantly, it will check all the values: stroke volume, the pulse rate, cardiac output, mean arterial pressure, systemic vascular resistance, CVP, and the fluid status by looking at the stroke volume variation by just looking at the pulse wave through an arterial cannula. So this is very important, as we can adjust our support according to the requirement. Before this instrument, we were adjusting noradrenaline, dobutamine blindly, without a proper thinking. But here, now if the systemic vascular resistance is low, we can increase noradrenaline to increase the resistance, therefore improve the blood pressure. If the stroke volume is low, you can improve the inotropes, increase the inotropes to improve the stroke volume. And the fluid status, stroke volume variation, if it is low, you can give adequate fluids. Not in that situation, not the noradrenaline, you have to give fluids. So you can nicely fine tune your hemodynamic support when you have this machine. So that is very important when it comes to when it comes to management of critical ill cardiac patients. And this is the savior, ECMO. It is not good if I not tell something about this machine at this point, because it is very useful to save the deteriorating patients. Extracorporeal membrane oxygenation, artificial lung and the heart. You can see the membrane, the red color thing, so which improves the oxygenation of the patient. It's the artificial lung. And there's a blood pump, which this is the console and the pump is there. So it is the artificial heart. So you can supply the artificial heart and the lung to the patient when those are failing, until those organs are either improved or either getting transplanted. So you can see the patient's blood will be taken from the vein, and this is the pump, this is the artificial heart, and pumps the blood, and this is the membrane where the oxygenation happens. Oxygen will be given through this to the membrane, and once the membrane oxygenation happens, the blood will be put back to the patient. So you can have the patient, you can save the patient, even the heart and the lungs are not functioning at all until those get transplanted. So there are two methods, VB ECMO and VA ECMO, separately to support lung and heart. So this is the ultimate tool, the ultimate savior for you to support the patient. And there are other instruments which can be used as survival kits. This is CRRT machine. You may know about that as a renal support. But remember, this is not just renal support, it will support the whole body. It will support the fluid removal, fluid status. By doing that, it will support the lungs, heart, gut, and everything. Supports the metabolism, electrolytes, this acidosis, and uremia, everything can be supported. So it is very useful to support not only the kidney but also the body's total metabolism and the lung and heart's function. And this is not available in Sri Lanka, but I should like to mention that this is Mars. So this is the artificial liver. So instead of when the patient is having liver failure, you will be able to use this machine to support your failing liver. So now you all have seen how the respiratory function, how the lung function, how the cardiac function, kidneys, liver are being supported in critically ill cardiac patients. But I have not shown the most important tool to save the patient. That is you. Without you, whatever the machine we are having is not going to function. The frequent monitoring, one-to-one care, and then the correct management in the correct time is the most important savior of the patient. However much we have sophisticated machines, patients may not be survived. So this is, you are the ultimate savior with proper care to the patient, and then the other machines will support to save the patient when they are having critical deterioration. I think within this brief time period, I will be able to introduce the life-saving facilities available in the cardiac intensive care units. Thank you very much.
Thank you, Nuwan, for that very interesting and comprehensive lecture. Of course, you highlighted the most important point. I couldn't have said better than that. Of course, it's the nurse that is the key patient, most important person in our management hierarchy. Let me, yes, Chandra, would you like to introduce the next speaker?
Thank you, Dr. Sandamali. So the final lecture for this symposium will be conducted by Dr. Lakshman Bandara, consultant cardiologist at District General Hospital, Nuwara. So basically the heart, as we know, is the driving engine of the body, but if the heart dysfunctions, it can affect the whole body, liver and kidneys especially. So he'll be talking on supporting the liver and kidneys in a critically ill cardiac patient. Over to you, Lakshman.